Most people think controlling blood pressure after 60 means a prescription on the nightstand, a low-sodium diet they hate, and a 30-minute walk they never finish. I've spent over 20 years in the medical field. I've read the labs, I've reviewed the scans, I've sat across from patients who did everything their doctor told them, and still watch their numbers climb. And I'm telling you, the approach most people are using is incomplete. There are two things you can do in under 5 minutes. No equipment, no gym, no special diet, that target the actual mechanisms driving high blood pressure after 60. Not the symptoms, the mechanisms. Clinical research backs both of them. And after decades of managing thousands of patients, I can tell you with certainty, most people in their 60s and 70s have never been shown either one. Stay with me. Because what you're about to hear changes what 5 minutes of your morning can do for the rest of your life. By the time you're looking at a number on that cuff, 138, 148, 158, the damage has already been happening for years, quietly, without a single warning, without a single symptom. That's the thing nobody prepares you for. High blood pressure doesn't ache. It doesn't send a signal. It doesn't slow you down until it's already done the work. It just operates every single minute of every single hour, pushing against your artery walls, wearing things down from the inside. The heart, the kidneys, the brain, all of it under pressure. All of it quietly paying the price. That's why we call it the silent killer. And that's not a phrase designed to frighten you. That is literally, mechanically, well, what is happening inside your body right now if your numbers are elevated and you haven't addressed the root cause? Here's what makes this especially urgent after 60. The damage doesn't age linearly. It compounds. Every year of unmanaged pressure is not just another year. It's another layer of strain on vessels that are already less elastic than they were at 40. The math gets worse the longer you wait. And the cruelest part? You won't feel it accelerating. You'll feel fine, right up until you don't. I've seen what the end of that road looks like. I've had that conversation with families in hospital corridors, and I can tell you, the people who ended up in those corridors were not reckless people. They were people who were told the standard things, who tried the standard things, and who were never shown what their body actually needed after 60. That changes today. Here's what frustrates me as a physician. A patient comes in with elevated numbers. What happens? They get a prescription and they're sent home with 3 words: watch your salt. That's it. No one explains what's actually happening inside their arteries. No one shows them what they can do about it in 5 minutes. And the medication, I'm not against it, please hear me. It helps, but it manages the number. It doesn't fix what's driving the number. It doesn't restore flexibility to stiffening arteries. It doesn't retrain the nervous system that's been firing incorrectly for years. Those are root causes. A prescription doesn't touch them. So patients take the pills, cut the salt, walk more. Or in 6 months later, they're back in the same chair with the same numbers, wondering what they're doing wrong. They weren't doing anything wrong. They were never given the right tools. Not because their doctor doesn't care, because the system wasn't built to give people real answers. It was built for the 7-minute appointment and the prescription pad. That's the gap. And that's exactly what the next 5 minutes will fill. Here's what changes after 60 that makes this so important. Your arteries naturally lose elasticity as you age. Think of them like a rubber band. A new rubber band stretches and snaps back instantly. It handles tension without effort. But leave that same rubber band in a drawer for 20 years. Take it out, stretch it, and something different happens. It resists. It doesn't recover the way it used to. That's exactly what happens to your blood vessels over decades. The walls thicken, the tissue stiffens, and a stiffer artery means higher pressure. Full stop. Now here's what most people don't know. Standard advice: walk more, eat less salt. It's not wrong, but it doesn't specifically target arterial stiffness. It doesn't speak directly to what your vascular system needs after 60. Because here's the part that changes everything. Arterial stiffness is trainable. Your artery walls still respond. They still adapt, but only if you give them the right signal. That signal is not a 30-minute walk. It's something far more targeted, and it takes less than 5 minutes. That's what this protocol delivers. Let me explain what's actually happening inside your body, because once you understand it, everything else makes sense. Your artery walls are made of smooth muscle and elastic tissue. When you're young, that tissue is supple. Your heart pumps, the artery wall expands, then recoils, pushing blood forward, keeping pressure stable. After 60, that cycle degrades. The walls thicken. The elastic tissue loses its recoil. Instead of expanding to absorb the pressure wave from your heart, a stiffened artery simply resists it. The pressure has nowhere to go. That's what shows up as a high number on the cuff. Now here's what most people don't know. Regular cardio, walking, cycling, swimming, is great for your heart. But it doesn't directly target arterial stiffness. It makes your heart stronger. It doesn't retrain the artery walls themselves. It gets the engine working harder. It doesn't repair the pipes. So what does? That's exactly where this protocol begins. 2 mechanisms, both clinically backed, both capable of measurably reducing blood pressure, both completely absent from the standard conversation most patients ever have with their doctor. Here's the thing about the first technique in this protocol. It looks like nothing. You're not running. You're not jumping. You're barely moving. Just holding still while your muscles work hard underneath. And yet the research on this is remarkable. A 2023 analysis published in the British Journal of Sports Medicine looked at every major form of exercise and its effect on blood pressure. Over 200 studies. The conclusion was clear. This specific type of movement came out on top, above cardio, above weight training, above everything else tested. For people over 60 with elevated blood pressure, regular practice reduced systolic pressure by an average of 8 points. 8 points. Let me put that in terms that matter. For many patients, that is the equivalent of adding a second blood pressure medication, achieved in under 5 minutes. No prescription, no side effects, no cost. That's not a small study. That's not alternative medicine. That is the best available clinical evidence we have right now. And most people have never heard of it. So what is it? Isometric exercise. And before you switch off, this is not what you think. A wall sit, a plank, positions where you hold still while your muscles contract hard underneath. That's it. No equipment, no gym, no impact on your joints. Here's the mechanism. When you hold a wall sit, your muscles contract and stay contracted. That temporarily restricts blood flow. Then when you release, Your vessels flood with circulation. They expand rapidly, and over time, that repeated expand and release cycle literally retrains your artery walls to be more flexible and more responsive. It is physiotherapy for your vascular system. Here's the protocol: 4 minutes total, 1 minute wall sit, back against the wall, thighs parallel to the floor, breathing normally. 30 seconds rest, 1 minute plank, forearms down, body straight, core engaged. 30 seconds rest, 1 final minute wall sit. That's it. 4 minutes. In your living room, in your pajamas. If you're new to this, start with 20 seconds and build slowly. But for most people over 60, this is completely safe and extraordinarily effective. Now, before we move to the second technique, and this one surprises people the most, I want to make sure you have everything you need to actually implement this. Because I understand it's hard to remember exact timing and sequencing from a video. You watch it once, you feel motivated, and then the next morning you're standing in your kitchen trying to remember how long to hold the wall sit and whether it was 4 minutes or 6. So I've put the complete written protocol together in one place. Exact timing, rest periods, both techniques laid out step by step. A simple daily tracking sheet so you can see your progress week by week. It's linked in the description and in my profile. It's free. Takes 30 seconds to access. Get it now before you continue watching, so that by the time this video ends, you don't just understand the protocol. You have it in your hands, ready to start tomorrow morning. Done? Good. Because what comes next is the part that surprises people the most. And once you understand why it works, you will never skip it. The second technique looks even simpler and works even deeper. 1 minute of controlled breathing. But stay with me, because this is not relaxation breathing. This is targeted neuroscience. Your body has 2 modes, fight or flight. Your sympathetic nervous system, accelerator pedal, heart rate up, blood pressure up, vessels constrict, and rest and digest, your parasympathetic nervous system, brake pedal, heart rate down, blood pressure down, vessels relax. Most people over 60 with elevated blood pressure are stuck with their foot on the accelerator, even sitting quietly, even at rest. Their nervous system never fully switches off. And that constant low-level activation keeps blood pressure elevated around the clock. Here's the protocol. Inhale through your nose for 5 seconds. Exhale through your mouth for 5 seconds. Eyes closed, sitting upright. 1 minute straight. That specific rhythm activates your vagus nerve, the direct line to the brake pedal. Studies show consistent practice reduces systolic pressure by up to 8 points. And because your arteries are already more responsive from the isometrics, these 2 techniques stack. They multiply each other. That's the whole point. Now here's the part that surprises people the most. The final piece of this protocol is water, but not the way you normally drink it. Here's something most people never connect. Dehydration and high blood pressure are directly linked. When your body doesn't have enough fluid, your blood becomes thicker, more concentrated. Your vessels narrow to maintain circulation, and narrower vessels mean higher pressure. Every time. After 60, this problem gets worse. Your thirst mechanism becomes less reliable. You can be significantly dehydrated and feel nothing, which means millions of older adults are walking around chronically underhydrated and wondering why their numbers won't move. But here's where it gets interesting. It's not just how much you drink, it's how you drink it. Gulping water quickly activates your sympathetic nervous system, the accelerator. But slow, deliberate sipping does the opposite. It activates the brake pedal, the same parasympathetic state the breathing just created. So immediately after your breathing minute, pour 250 milliliters of water. Sip it slowly. One small sip every 10 seconds. 1 minute total. You're not just rehydrating. You're locking in the calm your breathing already built. Now here's the truth about any protocol. It doesn't matter how good it is if you don't do it consistently. And consistency doesn't come from motivation. It comes from design. The single most effective strategy for making this stick is habit stacking. You attach the new behavior to something you already do automatically every single morning without thinking. Pick one anchor: making coffee, brushing your teeth, sitting down for breakfast. The moment that thing is done, you go straight into your 5 minutes. No decision required, no motivation needed. The anchor triggers the protocol automatically. Your brain doesn't treat it as a new habit. It treats it as an extension of something familiar. That dramatically reduces the friction that kills most good intentions by day 3. Second thing, track it visually. Get a paper calendar. Hang it somewhere visible. After each completed session, draw an X. After 7 days, you have a chain, and the psychology is powerful. You genuinely don't want to break it. If 5 minutes feels too much at first, start with 3. A smaller version still delivers real benefit. Starting small beats, not starting at all, every time. Now I want to be straight with you. Because there is a lot of noise online about natural approaches to blood pressure. So let me tell you exactly what the evidence shows and what it doesn't. Isometric exercise and blood pressure. This is one of the most robust findings in recent cardiovascular research. That 2023 British Journal of Sports Medicine analysis covered over 200 studies. The conclusion was clear. Isometric training produces the largest reductions in blood pressure of any exercise type tested, particularly in older adults. That's not a small study. That's the best available evidence we have. Resonance breathing, multiple randomized controlled trials, meaningful reductions in blood pressure with consistent practice. The vagus nerve connection is well established in neuroscience. This is not alternative medicine. This is physiology. Hydration and blood pressure, documented and consistent across studies. Chronic mild dehydration raises pressure. Adequate hydration reduces it. What the research does not show, that any of this replaces medication when numbers are dangerously high. Above 160 systolic, this protocol complements treatment. It does not substitute it. Please work with your doctor. That part is non-negotiable. I've seen people try this protocol, give it 2 weeks, and tell me it didn't work. And almost every time when I ask them to walk me through what they were doing, I find the same mistakes. Let me save you the frustration. Mistake 1. Holding your breath during the wall sit. This completely undermines the protocol. When you hold your breath, pressure spikes temporarily instead of dropping. Breathe normally throughout, steady and relaxed. If you can't breathe normally, you're working too hard. Reduce the intensity. Mistake 2, rushing the breathing exercise. 5 seconds in, 5 seconds out. I've watched people do 3 seconds in, 2 seconds out, check their phone. That's not resonance breathing. And that's just sitting. The specific rhythm is what activates the vagal response. Set a timer. Commit fully. Mistake 3, gulping the water. Small sips. slow pace. Gulping cancels the parasympathetic state the breathing just created. Mistake 4, skipping days and calling it failure. You will miss a day. That is not failure. The only failure is deciding a missed day means it's over. It doesn't. You start again the next morning. Here is scene 14. Paradigm comparison, big pharma contrast, built strictly on the framework's US versus industry plus superiority framing, plus compound effect blueprint. Scene 14, paradigm comparison, big pharma contrast, us versus industry plus superiority framing plus compound effect claim. Here's something I want you to sit with for a moment. So pharmaceutical companies spend billions developing drugs that target one mechanism of high blood pressure. 1. A calcium channel blocker works on vessel tension. An ACE inhibitor works on fluid regulation. A beta blocker works on heart rate. Each one is a single tool aimed at a single target. This protocol hits all three simultaneously. The isometrics retrain your artery walls directly. The breathing resets your nervous system. The water reduces blood viscosity and locks in the parasympathetic state. 3 root causes. 5 minutes. Every morning. And here's what makes this different from any medication. It compounds. A pill works while it's in your system. You stop taking it, the effect stops. This protocol builds on itself. Your arterial flexibility improves week by week. Your vagal tone strengthens month by month. Your hydration baseline stabilizes. The numbers don't just drop, they stay down. 0 side effects, 0 cost. And the longer you do it, the stronger the effect becomes. No drug on the market can make that claim. I've been a doctor for 2 decades. I've seen what happens when blood pressure goes unmanaged for decades. The strokes, the heart failures, the kidneys shutting down, the conversations in hospital corridors with families who had no idea how long this had been building quietly in the background. I've held the consequences of neglect in my hands, and I can tell you with absolute certainty, the 5 minutes you spend on this every morning are worth more than you can possibly imagine right now. This is not about avoiding medication. This is about giving your body every possible advantage. This is about being proactive instead of reactive. This is about showing up for yourself at 60, at 70, at 80, with the same intention and discipline that built everything else in your life. Your arteries are not done. Your nervous system is not done. Your body still responds. It still adapts. It still heals, but only if you give it the right signals. Starting tomorrow morning, 5 minutes. That's the investment. The return is years. So let's bring it all together. 5 minutes, 2 steps every morning. Minutes 0 to 3. Isometric wall sit. Slide your back down the wall until your thighs are parallel to the floor. Hold. Breathe normally. In and out, steady and relaxed. 3 minutes total. Start with 30 seconds if you need to build from there. You're retraining your artery walls to expand, release, and respond again. Minutes 3 to 5. Resonance breathing. 5 seconds in through your nose. 5 seconds out through your mouth. Eyes closed. Sitting quietly. Feet flat on the floor. 2 minutes. You're firing your vagus nerve and pulling your nervous system off the accelerator, directly lowering the pressure those arteries are holding right now. That's it. 5 minutes. No equipment, no gym, no pills. Stack it onto something you already do every single morning. Coffee, brushing your teeth, sitting down at the table. The anchor triggers the protocol. No decision required. Track it on a paper calendar. Mark your X. Give it 6 weeks before you judge the results. Start smaller than you think you need to, but start tomorrow morning. Which of these 2 steps surprises you the most? On the wall sit. The fact that holding still does more for your blood pressure than a 30-minute walk? Or the breathing? The idea that 2 minutes of slow, deliberate exhales can directly dial down your nervous system and relax your vessels? Let me know in the comments. I read every single one. And if someone in your life is over 60 and struggling with their numbers, a parent, a spouse, a close friend, share this video with them. It might be the most useful 5 minutes they spend this week. Forward it, text it, leave it open on their kitchen table if you have to, because this information should not be locked behind a consultation fee or buried in a medical journal. It belongs to the people who need it. I don't run ads. I don't push supplements. I don't take brand deals. I never will. And what keeps this channel going is people like you. People who believe that evidence-based medicine should be accessible to everyone, not just the people who can afford the right doctors. If that matters to you, subscribe. Take care of yourself. Be consistent. Your body is still listening. Start talking to it differently tomorrow morning. And before making any changes to your health routine, especially if you're on medication, please speak with your own doctor first. That's not a disclaimer, that's just good medicine.